Can you see me?
Yes, sir. Yes, we can.
Sir, we all can see you, sir.
Okay.
Very good evening.
Okay.
I'm your very grateful student, Dr. Paul. You know me,
Yeah.
and I'm going to for a few minutes. I will introduce Dr. Patta Radhakrishna, who is a senior surgical gastroenterologist of enough fame and accomplishment. Dr. Radhakrishna is in Chennai. He is a senior consultant and HOD in SIMS Hospital. This LGS forum was his brainchild. I can't remember, it was around 2013 or 2014 it was started. We didn't realize that it will grow to this extent. So I'll request Dr. Radhakrishna to welcome you on this platform of LGS, and then I'm going to take over for
on behalf of Dr. Girijadath Sharma, another senior surgeon from Delhi, and myself, Dr. Patta Radhakrishna, we have great privilege in welcoming you, sir, to this forum, because this forum is a Facebook group of over 35,000 doctors across the world, mostly surgeons, and a lot of them are youngsters. And we've been conducting aggressive academics over the years. And then recently, with Biswarup Pal, we started a series of long chat with the legends. And actually, this is the third in a row. And in cardiac surgery, there can't be a bigger personality than you, sir. And we thought it would be a wonderful. We took the risk of Biswarup getting in touch with you to spare some time on this forum and chit chat with us to see how you grew from nowhere to what you are now, and we want to know the story, your story in your own words. Welcome, sir. Dr. Biswarup.
It is my absolute privilege and joy to have this conversation with Dr.Cherian. I never thought I'll be having this. You know, for most of us, some of us who had the privilege of working with Sir, it was not actually about surgery or cardiac surgery. It is far more important to me, at least, has been what we learned from him, the person, Dr.K.M.Cherian. Technique, surgery is on one side, because there are innumerable standout things that I remember. And first and foremost for me, what I learned from Sir is the word courage. Courage is a very simple word, but that one quality and one trait which and tremendous self-belief, these two combined, and I have seen why Sir has been architect for as a path-breaking journey in cardiac surgery evolution in India from 1975 till now. And these two qualities to me made Sir or enabled Sir to push the frontiers of science. One of the important things I realized while working with Sir, and it remained in my mind at a very young age, that I always found Sir questioning the present and thinking of a different future, better future, not just different. And thereafter putting in every possible effort in every possible direction to reach that goal. And for me, Sir has always inspired all of us to dream and think outrageously within the limits of logic and putting in everything that we have to achieve that. With this, I don't have the audacity to introduce Sir's CV on this forum. That is available as a legend in various platforms on Google or everywhere. I will touch upon some landmark points during this conversation. And I'm going to bring in some of our cardiac surgical colleagues who will be coming on the screen, Dr. Soma, Dr. Satya Prasad, and Dr. Suresh, few others. So, sir, if I may start from the point in 1975, when cardiac surgery itself worldwide was in its embryonic stage. At that time, as after finishing MS from Manipal, what made Dr. Cherian to venture into this rather uncharted field in India at that time? If I can hear from you from that point for some time. Thank you, sir.
Yeah. Well, thank you, first of all, for the invitation to speak to all of you. Now, I think probably you know me from 1993 or so.
That's right, exactly, sir. You distinctly remember.
Yes. So, as far as I am concerned, I always believe that I've been destined to become a cardiac surgeon. There is no second thoughts about it. Even though I did not have any family background of medicine. My father has been he was a planter, and I grew up in the plantations early, and I do not know. This is from my mother. I understand that when she was 3 months pregnant, carrying me, a tribal
Yes.
man from near Nilgiris, he used to come to our house once a month. They will come in the morning, go back the next day. You can think of 1941, the Nilgiri hills. We had very high incidence of malaria and a lot of wild animals, etc. That is why they come in the morning and cook there and stay. And next morning they go down, buy whatever they want. Because in the hills, you don't get two things. One is salt,
Yes.
and the other is, that is a barter system. They will bring tobacco and then they get salt. So this man found that my mother had hyperemesis. So he asked her, "Are you pregnant?" She said, "Yes." "How many months?" "4 months pregnancy." Then he just told, "See, you are carrying a boy and he'll be born on a Sunday at midday, 12 o'clock. And he will have a mole on his right wrist. That is why I wear my watch on the right. I have a mole. And he will become a heart surgeon." See, this is 1941. Somebody from, the uphills, a tribal, saying that there is heart surgery. You know when heart surgery was started. The first PDA was started. So this is almost 10 years before that. So that is why, it is important for me to say that this happened. Yeah,
Yeah.
this happened, and I was born on a Sunday at 12 o'clock, and I have a mole on my right wrist. So this is why I believe that, like the Greek philosopher Epictetus said, surely God chooses his servants at birth or perhaps even before birth. This is my father and mother, my brother, my brother, and I am the one who is sitting in the center. This was our house in Nilgiris. Then I used to have interest in cardiac work because you won't believe. I used to catch all these lizards and chameleon and all, and dissect it with a blade and see the heart. This is when I was 9 or 10 or 11 years old. Then I went for medicine. I did my senior house surgery in CMC Vellore. During that time, before I could get for MS, that time MS was 2 years. In CMC, it was 3 years. And if you are outside CMC hospital,
Yes, sir.
it was 4 years. So I was not prepared to face 2 years. So I went back to Kasturba and I got the seat because I was supposed to be a good student. And I finished my MS. And when I was doing my general surgery, house surgery, there were 2 cardiac surgeons. One was Dr. McFay, who was from South Africa. The other was Dr. John N. Wilson. He was the professor of cardiac surgery, University of New Mexico in Albuquerque. We became good friends. So I had seen 2 months of cardiac surgery. Then when I got for MS, Professor M.B. Pai and Yogesh Pai told me that Dr. S.R. Ullal has come back from UK after his FRACS success. He was together with Sir Yakub. They were the registrars for together in Birmingham. So they wanted somebody to help Dr. Ullal to start the cardiothoracic work. So Professor M.B. Pai asked me whether I will go. I said no, I can't go for that because I am doing general surgery. I want to do general surgery. There is no point in doing cardiac surgery because I will never be a cardiac surgeon. He said no, you go for it. And thus I was introduced to cardiac surgery. So this is during my first year of MS. That was in 1967. Now nobody will believe today closed mitral valvotomy was a very major operation, not undertaken in many hospitals. I think probably Calcutta, A.K. Vasu was doing
yes.
and in Bombay, it was P.K. Sen and Bastu, Magaji Mehta, and yeah, I think they were the people. So I had the opportunity to do a closed mitral valvotomy during my first year of MS. That was in 1967. Just imagine how many years. It is more than 45 years. And that was because of Dr. S.R.
Okay.
This is Dr. S.R.
Okay.
So he has been my mentor, my teacher, my guide, and everything. But before I appeared for MS General Surgery, I had done PDA, closed mitral valvotomy, coarctation of aorta, including Ivor Lewis. So I got a big kick and a start. And then naturally, it's like getting addicted to any of this ganja or whatever it is. I also had the opportunity, we were working together. He made me work with him. This is a Mazda machine, what you see below. And this one. Okay. So we were doing some dogs also. So we put the dog on bypass and invariably it dies. But I get the opportunity to do gastroenterostomy, EJ. We could not find the vectors. And as you know, dog has got large spleen. So I could do a lot of splenectomy. So GJ, pyloroplasty, and splenectomy. These were my favorite topics. Now from there, this is St. Vincent's Hospital, Sydney. I was the first patient to be taken here, but that is not the hospital. I have not seen it. I mean, I have seen it maybe about 6-7 years ago. But this was the hospital, back of the hospital, where you can see St. Vincent's Hospital camera on me. That was the cardiothoracic unit. This is where Dr. Windsor, Mark Shanahan, they were working, and I became the senior registrar there, even though I did not have any FRACS or. So this is all, you are destined. So nobody can stop it. So I happen to be the first Asian. Usually in St. Vincent's, it is run by the Sisters of Providence. You have to be a doctor's family. Father should have been a doctor. And they have to be whites and preferably Catholics. Now, this is the time when I went to Australia as a migrant, 1969. That was a white Australia policy. They will not have anything. I don't know how I got that, because I didn't have any of these class, distinctions. So this is the camera on me, and you will also see that 1971 September, I could do a first open heart surgery. That was a pulmonary valve opening. This is that, the surgery. And in fact, this is a patient. I'm just telling you because we are all locked up or locked down with COVID-19. I'm showing you this because I operated in Wuhan cardiothoracic unit exactly 6 years ago. I used to operate in China for 10 years. Every year I used to operate for a week or 10 days. This time it happened to be Wuhan. I completely forgot about Wuhan. When they said, oh, this started in Wuhan market, and I was just thinking that this name is familiar to me. Then Dr. Sambat Kumar in All India Institute, both of us went once. He came to give a lecture, and then Sambat Kumar told me, KMC, don't you remember we were in Wuhan and you were operating in this place? So then I looked and I found out that this was the place and this is where I could operate. Now, what I wanted to tell you is this. I didn't go there as a fellow or as a, at a lower level. I went to Australia as a migrant. And also I had a green card, mainly because I passed the ECFMG when I was doing my senior also, senior window. We used to have the examination conducted in Chennai, this ECFMG exam. So I had a green card. This is the number of my green card and the social security. And so I had, migrant status to 2 countries, Australia and US. My first job was that of a senior house surgeon to begin with. Later on, this was in St. George Hospital. That was my first job. And he was my first boss, Mr. Windsor. He is the first one who did the transplant in Australia. And His second was Mr. Mark Shanahan. Then from there, I was interested in pediatric surgery. I know you asked me why you are interested in pediatric. Now, I have many reasons to say.
I will come to that, sir, at some point.
Yeah, whatever it is. I went to New Zealand mainly because of Barrett Boys.
Yes.
I've heard of him. And of course, since I've been in Sydney for 3 years by that time.
Yes.
And I went to Green Lane and I worked with Barrett Boys. And, that was a good break. The reason is a lot of people used to come there at that time because profound hypothermia, circulatory arrest was done in Green Lane, and the second place was in Buffalo, New York, by our Subramanian. He is no more.
Sir,
So this was the cardiothoracic unit in this photo was taken in 1974. You might know this man. This is Roger Mee.
second
This is Ken Graham. This is Alan Kerr. This is I.M. Rao. This is me. This is Peter Faulkner. These two girls, they were in the intensive care. So this is a St. Vincent's. Now I came back. You will ask me, why did you come back?
Yes, sir. Actually, I was before I entered that.
That everybody asks me the same question. Why did you come back? Sometimes, even now I think, when I go through a lot of difficulties, I always think I should not have come back. I would have also made a lot of money. I would have retired very comfortably, have a big house with a swimming pool, going around the world every year. But why did I come back? My parents never talked to me for 1 year because I came back. My brother, he migrated to US. My sister migrated. So I thought, let me go back and see what I can do. Anyway, I am a migrant. If I don't like or if I fail, I can go back. And I had a couple of job offers. Now, this man, you may not know. I think he is one of the most important person in this country. Before anybody did a coronary angiogram or a cardiac catheterization in this country, I can say that Dr. L.R. Parsasarthi, he was a radiologist. He was the one who did coronary angiogram much before Vellore or the Delhi, there was nothing. Only Sujoy Roy was there, but he was not an interventionist. In Bombay, there was nobody. K.G. Nair, Sushil Munshi, all these, they have never done it. So this man, L.R. Parsasarthi, with his DMR degree, he was the first one to do the cath and he was the first one who did angiogram. And lot of people learned from him. Today is supposed to be senior cardiologist, everybody in Chennai, not only in Chennai, all over. They all learned it from him. And what we had was a Philips rapid changer cutting machine. That's all. No cath lab. This is Dr. Kalyan Singh. You will know.
Yes,
I think he is the first dedicated and exclusive cardiac anesthesiologist of this country. Only one person who was exclusive at that time was Dr. B.A. Punnus in All India Institute. But unfortunately, All India Institute was not doing it. So I would say Kalyan Singh. And this man, he was a diploma holder in signal and telecommunication of ICF. And he was our perfusionist because he was quite mechanically good and he could understand. Now, a lot of people have gone abroad. They have worked. Probably, no, I mean, no, not probably, it is. Because I told these people, I am going back home. Let me see whether I can do something. So this Royal Alexandra Hospital for Children in Sydney, which is not there now. And John Noitz, he was the chief pediatric cardiologist. There was no pediatric cardiology division, but he was looking after all the pediatric. These people said that they will come and help. So we made a program in such a way. There's John Overton and John Jackson. He was perfusionist. He was anesthesiologist. He was the cardiologist. So I had a very good team. And 1975 September, we collected cases because there was nobody operating. CMC hospital was operating up to 15 kilos, nothing below that, and that too only ASD, BSD, and tetralogy, nothing more than that. So we had the opportunity to do. See, we have been using an Olsen pump. This is, an old pump with a discogs in it. You can see the discogs here. You may not know, this man is a big cardiologist now, Dr. K.M.Cherian. He was my perfusionist. Now you please note, this is the first coronary artery bypass. Cotton mask, no headlight, no loop, we didn't have diathermy, we were using Igley saw. So there was no proline at that time. We were using 7/0 silk and there was no AC. So because the AC is not there, and Chennai. So we were using fan in the theatre. So this 7/0 silk will fly. So to make it sit on the field, we used to use sterile liquid biography. See, there is no Castanavia needle roller, no special forceps. And unfortunately, even though it was railway, we did not have a standby generator also. Now I'll just show you this is not the first coronary artery bypass. This is in 1979 because Doordarshan wanted, because nobody was doing coronaries. Now you see, Padmashree was a very famous.
How bypass surgery is actually done. An incision is made down the middle of the breastbone. The bone itself is cut with an electric saw, and the heart is
the
exposed.
photography, etc. will be very clear. By 79, we are improved. So we have a diaphragm.
The main covering, known as pericardium, enclosing the heart, is cut to lay bare the heart and the great vessels, mainly the aorta. The heart is connected to the heart lung machine. The surgeon inspects the heart thoroughly to determine where the blockages exist. In this case, you can see 3 blocks. Therefore, 3 bypasses are necessary. The main descending branch of the left artery is opened beyond the blocked area. Beyond the block to ensure that blood will pass free at this point after grafting is done. One end of the vein is stitched into the opening of the coronary artery using special suture material as thin as human hair.
So by that time we got proline. This is 1979.
The vein is joined to the artery with very delicate, accurately spaced sutures. This is the most crucial point in the surgery. After ensuring the patency, the suturing is completed and tied. Once the veins are attached to the coronary arteries, the clamp on the aorta is removed. This resumes the blood supply to the heart, allowing it to beat. The sooner the blood supply and normal beating is restored, the better it is for the heart function. In this case, only 2 openings are made in the aorta, as one vein has 2 branches for the 2 branches of the left coronary artery.
This is what we used to call biography.
Yes, sir.
Beating normally, and the chest is being closed.
So the only difference is this. We were doing everything on a still heart, cardioplegic arrest, etc. Now, today, the young generation will think these fellows are all very old, they can't. But mind you, even this was a hard task for us. Mr. Khaja Moideen, who was a engineer in the ICF, Integral Coach Factory, he was the first patient to have had a bypass surgery in the country. And this is Mrs. Daisy DeCosta. She happened to be the first lady who had bypass surgery. That was, June 75. Yeah. So this is, even this, the paper that was known as Madras Mail. It is no more, there is no more Madras Mail. Now, these were our, by the time, we slowly progressed. Because it was railways, I could do all these things. If I were in All India Institute, where Dr. Govinath asked me to join, I would not, I didn't go. The reason is, I knew that I will never be able to compete with the other people who were there. Venugopal was there, I.M. Rao was there, M.R. Girinath was there. So I thought the best thing is not to get into that crowd. And Vellore, I would not have done anything. So, I'm being very frank. I think at this age and with this, my seniority, I can be very candid. Stanley
Yes,
John would not have allowed me to come up at all. So I didn't go to Vellore. And because there was a lot of support from the railways, especially Dr. K.M.Cherian, even though he was a physician, he had so much of interest in developing cardiac surgery. He will go out of the way, and he was known to everybody in the railways. So there was no problem to get all these. Now this is profound hypothermia induced with surface cooling. All the pediatric cardiac surgeons today who are there in this country, they would not have seen this because we abandoned it. And this is a K-cross discoxygenator. Biswarup, I am saying these things because not many
Yes.
people have seen a K-cross with discoxygenator.
Yes, sir. That's what this show is for. Thank you, sir.
Yeah. Now, this is our ICU. This is a 3.2 kilos, and this child had a TAPVC. Can you imagine doing a 3.2 kilo child TAPVC? Because we did not have an echocardiogram. The only echocardiogram in this country was in CMC. That was an M mode, second hand, which was given to Dr. Vaidilingam by Helen Taussig. Vaidilingam worked with Helen Taussig in Baltimore, that is Johns Hopkins. And when she left, Helen Taussig gave her a mode. And after that, in railways, we bought. So you can see, I mean, here now you will have so many infusion pumps. Now, for the people who are interested, I mean, like Biswarup and all, see, this is our PEEP. This is your soda bicarb,
Yes.
bottle.
Bottom.
Yeah. So this is a locally made PEEP.
Exactly.
But the whole thing was this. This is these are the kids who were operated in 1 week, which included kid from Palestine, kid from Kenya, etc. And we started medical tourism. But this is later on. Now you will see, we had the first exclusive pediatric cardiac intensive care. This was being inaugurated by Don Ross. You can see some of the, this is K.R. Balakrishnan.
Yes.
This is
Here
Rajan.
S.K. Rajan.
This is Dr. Suresh Rao.
Yes.
This is Krishnamana, not, what is his name? Murlima. I forgot it. Anyway, this is Richard Sardar. This is much later. This is it in 1988.
This is 88, yes.
Yes. So we progressed.
Sir, can I?
People were not doing, I mean, lot of people told me, I mean, you are adventurous, but don't do an arterial switch, because patient will bleed and die. The fellows who are telling me are the people who have never seen an arterial switch. This is the sad part. So, this is the first arterial switch.
Yes.
This is 31 years later. This fellow is a software engineer in US. This was taken in 2015, so 6 years old. This is the first sending. Baby Mariam. She has grown up. She has got 2 kids. And this is one of the Alcapas. The earliest Alcapa, probably the first one, which we did using the left subclavian artery directly to the left corner. This was done, and this, of course, this CT angio was not there. This CT angio was done 29 years later, where we had replaced the mitral valve also for this child who was 1.5 years old. All this done was through the left thoracoid before cardioplegia was introduced. We introduced cardioplegia in 1979. I know somebody else got Padmashree or whatever it is for introducing cardioplegia in 84. So this is how the things work in our country. And this is about Madras Medical Mission. What I wanted to say is that this man gave his house, the front portion of his house, to conduct this is where we started Madras Medical Mission, a clinic. Sometimes I used to, this is when Mr. Abraham, he is 99 years old. This October he will be here. So this was done,
Yeah.
the OP was conducted from later on it became Madras Medical Mission. And this is the first TMR in Australasia. Before Australia or New Zealand or Japan or anywhere else, TMR was done. He did this TMR. I know Prasad is in that audience. I suppose he is there because he became master of that. Prasad is there?
Prasad?
Yes. Satyam Prasad.
Yeah, yeah. Satya Prasad, are you still there? I saw you there.
Okay. Anyway, he became a master of this. So this is TMR. Now came the question of legalization of brain. So the first meeting regarding this brain death was conducted in Chennai. Dr. R. Srinivasan was the principal secretary of health. And we conducted a meeting, and then later on in Bombay, Calcutta, and Delhi, and it was taken to the Parliament, upper house and lower house. It was legalized. That is how we got the legalization for brain death. Now this is, I had a lot of help in that. This is Christian Bernard and latest one.
Yes, Satya
So
Prasad
this
has
my
come in.
father and mother and family. Chris Bernard came for the inauguration of Madras Medical Mission, and this is the lady who had the first transplant, Maimundini. This is the infant transplant. This was done in 2009. Mind you, this heart was brought from Bangalore, and the whole time, that is the cross clamp, excision, and flying from Bangalore to Chennai, and then from Chennai airport to our hospital, altogether our ischemic time was only 2 hours and 45 minutes. Which means only one thing: coordination and teamwork is the most important thing. Why we could do all these things, we had a good team approach. And I think that has gone everywhere. Bombay was trying to come up, Delhi was trying to come up, everything. But they didn't have this team approach. This is what I want to tell the junior surgeons. It is not anybody can operate. It's nothing big as far as the surgical technique is concerned. But coordination, teamwork, very important. We also had the opportunity to do 2 hearts in one night. And at that time, that was in 2010. That happened to be the third case in the world where 2 heart transplants were done in one night. And one was in Newcastle upon Tyne, the second was in downstate New York, and the third one was by us. Now we also had but after that we did a couple of bilateral sequential lung transplants, and then we did a heart and lung, and this was the second case. And this fellow joined back his job. He was 32 years at that time. This is 2017, the transplant Olympics in Spain. This girl had a transplant. Her name is Reena. and she was the flag carrier for India. Why I shown that? 8 years after that, one night she was brought from Bangalore in cardiogenic shock, and as soon as she reached, she arrested. So we resuscitated her, and she was on INEP, and she was on ECMO. So we kept her on that, waited for 4 days to get a suitable heart, and we transplanted her. This is, I think, 10 or 13 days after her second transplant.
With advanced symptoms of heart failure,
2011, we had the opportunity to put the first
dilated cardiomyopathy with
Vellore.
severe LV systolic and diastolic dysfunction.
And subsequently, she had, she was on this levotronics for 39 days. She had a heart transplant because we got a good heart for her. Her two daughters were doctors. Now we have been talking what we have done, but we should not rest there. We should progress further. So we have gone for heterotrophic heart transplant, and this is a dog who had a heart plus another heart in the abdominal cavity. Because we are throwing away heart, saying that ejection fraction is poor, that etc. So we have to preserve. We should not throw away organs, and we can always have either you can have a piggyback, but I feel it is better to have it in the abdominal cavity because it will not compress or it will not jeopardize the heart of patient, whether it is ejection fraction 10 or 15. But if you give another heart with another 15 or 20, I think the kid, I mean the patient should do well. But for all these things, it is important to have a research facility for you to. Now, I'm just talking about the heart failure. This is the stem cells. Again, we are the only people doing cardiac stem cells in this country. And now we have done 127 cases, which was presented in PCR 2 years ago in Paris. So this girl, 2008, this is 2014, and now she is the cricket captain. She is from Bombay. The other is, now we are working on this, what do you call a Q heart. That is to improve the function of the heart. And this is a pig which had a Q heart, and we had 6 pigs. And I'll tell you, it is all thrilling, you get personal satisfaction, but I just want to tell you one thing. Please don't get into these things. This, our government, whether it is a present government, previous government, whichever government, they are not interested in this. TDB, DBT, VST, everything. All are controlled by people who have nothing to do with medicine. One is a plant biologist. The other fellow is something else. And they become secretaries. If you go and tell them that they don't, it is very difficult even to see one of these fellows. So, if you think that you are going to get any cooperation, support, etc., from these government agencies which says that they are sitting there for helping us, please forget it. Now, I will stop here.
Yes, sir.
Since we are going into a little bit of future, that is regeneration.
But
now let me know what all questions you have got. up to here. Then I can go to the.
Yes, sir. Sir, actually, we were enthralled by this last 35, 40 minutes. It was like a time machine going backwards and then rolling forwards. But if I can take you back to the time when you stepped out of railway hospital. Railway hospital was like a fantastic place, but you stepped out to do something because at that time to decide to start a freestanding single organ hospital which will be financially viable and yet evolve into a massive worldwide famous institute as it turned out to be in due course. But that starting point, that
No. I'll just answer that in one word.
uh,
You said financially viable.
hmm,
Railway is not bothered about your money. Railway makes money only from passenger traffic and goods traffic.
hmm,
And, railway has to look after their patient population.
hmm.
That is their workers. So we were allowed to do only 10% of cases non-railways. And they are paid, they get a free ticket, they get free accommodation, they get free food, they get free surgery. That is why railway could do it, which other people could not do.
No, I'm talking
Now,
about, yes, sir.
see, finance is very important. You are
Yes,
all working in private hospitals.
yes.
Now, you think any of the private hospitals, including Reliance or run by Reliance or any other people, you can't do it. Today, with this COVID problem, for the patients who have got COVID to get admitted in a private hospital in Chennai, I don't know about other places,
Hmm.
you have to have a deposit of 3 lakhs
Yes.
and 1 to 1.2 lakhs or something per day. How many people can afford?
Yeah.
Now, I have got a bill. I have to put it up. I'm sure that you know uh, you can get it. That is a patient, a non-railway patient who had a mitral valve replacement. At that time, with an ATS valve, the total cost was 14,000 rupees. Out of that, 2,000 rupees was the cost of the valve.
Right.
So
No,
it is
sir.
very, very difficult.
No, sir. Actually, I was asking when you stepped out of railways
Yeah.
to start a first private freestanding cardiac hospital,
Yes.
MMM ICVD was the first freestanding single organ hospital, cardiac hospital.
Yes.
That was for that time was a phenomenally gigantic state. Of
Yes.
course, so I thought if you could take us to that point and the initial few weeks or years. I have Satya Prasad here, Soma here. They all were initial colleagues of your this journey.
Now, to answer that, the Madras Medical Mission did not have any money.
Yes.
104 people, 5,000 rupees each is 5 lakhs and 20,000 rupees. Now, will you start something with 5 lakhs and 20,000 rupees? Anybody in this country?
Yes. Even at that time, that's what I wondered.
Yes. That is why I said the reason is this. Even my friends who
Hmm.
were members of Madras Medical Mission, they all said this is all what we can give. When we started
The
work
shoot
in Vijaya Hospital,
Vijaya Hospital. Yes.
rented premises.
Yes.
When we started the first day, I still remember the Secretary of Madras Medical Mission and the President who was a bishop. They said we don't have any assets. We are depending on him. And lot of people told me, you can start on your own. I didn't do that, mainly because I thought I'm working for the society. I got the opportunity. I came back leaving these things. So why should I worry about it? See, I will tell you one thing. This is like Alexander the Great.
Yes.
Yeah, he conquered all the world. Before dying, he called all his generals and said, the road through which my body will be taken has to be laid with the gold, silver, precious stones, and diamonds. Because I took all these things from other countries. But please leave 2 holes by the side of the coffin and put my hand outside. That means he wanted the world to know all the countries which he invaded and conquered. Everybody he wants to know that they are made sure that he is not taking anything. He is going empty hand.
Yes.
Same way, whatever one might say, Mercedes Benz or BMW, all these things. Once you have used all these things, you don't have any interest. I mean, somehow you have to reach some place, whatever it is, 4 wheels, that's enough. But this is what is important. You are not going to take anything. And
Yes.
as somebody said, if you want to inscribe something, not on the tombstones, but inscribe it in others' heart.
Yes.
We have the best opportunity to do that. By the time people realize it, you're not. I mean, a lot of my friends, my colleagues, a lot means, at least more than half of them, they have become sick. Some people are dead, and some people have got, uh, you know, Parkinsonism or whatever it is. So this is the other thing. What is important is your health. So that way, I'm very lucky that till now I have no problem. And 8th of March of this year, I have retired from my clinical surgery. It is not that I can't operate. I can
Yes.
operate, but I don't want to operate. I don't want to make a mistake and say that, oh, this fellow has been doing well. In the end, he made a mess of it. I don't want to do that.
Well, that is exactly that.
Yeah, I
When
don't
to
want
call
to
it?
be,
Yes.
that is what I am saying. As far as the junior surgeons are concerned, this is all temporary. Please don't think that you are the only one who can do it. Everybody can do it. As long as you don't have a severe increase. Anybody can do it.
Exactly. Because
Okay. Yeah, is there anything else you want to ask me?
yes, sir, plenty. Because
Okay.
I mean, I know it's going long, but sir, at that time, a good number of your contemporaries went into coronary bypass surgery. It was the market commodity. Even by that time, your contemporaries were either adult surgeon or pediatric surgeon. But if I can remember, you were the only person of your generation at that time who decided to or did everything from adult to smallest 2 kg, 3 kg children. So could you tell us about that mindset? And
Yeah, see, 13th June 1975, I did the first bypass
yes, sir.
in railways. September only, Dr. Girinath joined. He had not seen a coronary artery bypass by that. And I told him, Giri, I will help you, but let me do 25 cases. After that only they all started. They all made money. They are all millionaires, and I'm quite happy with that. I don't have anything. In fact, the only cardiac surgeon who has been declared by NCALT
Exactly. I was coming to that.
as insolvent and bankrupt is me.
Yes, but at the same time, you are the only cardiac surgeon who did the first CABG and also is in the top 20 pediatric surgeons in top 20 innovative pediatric surgeons, which included other surgeries also, but this also as top 20 most innovative pediatric surgeons.
See, that is Google would have got some data from somewhere. See, that is not the important thing. See, there are a lot of things which I have done for the first time.
Yes.
Whether it is pediatric transplant or heart and lung transplant or sequential lung transplant, this is all done long time ago.
Yes.
So that is all the satisfaction which I needed.
Exactly.
And I never wanted anything else because, what I need is only a good life. I have seen the best part of my life. When I was young, see, when I was 26, when I was 26, I went to Australia. So after that, all these years, there and years, everywhere, I had the best opportunity. I made use of it. I enjoyed life also. There is nothing to regret for me. Tomorrow, if it is said that, okay, I have to go up, I'm very happy because I have done. And, I don't have any craze as far as this is concerned because I have done what the purpose of me coming back was for my professional satisfaction. I got that. I got that more than anybody else. So there is nothing for me to complain about. I should be happy.
Yes, sir. And also,
he has been very, very kind to me to see that I got everything what I need.
sir, this other thing that before I invite a few of my colleagues, other thing is, even at that time, you were the MMM was the first place where you wanted to install, and you actually installed the first homographed lab, which is still benefiting the entire city, entire state. In I think it was year 1994, September or October.
No,
for that.
We started the homographed wall bank in 1998. That is when Grace Koshi was there.
Yes, Grace Koshi, Dr. Grace Koshi was there.
And we copied whatever they were doing in Green Lane. And I had gone to Brisbane and I spent 2 days with Mark O'Brien and got the technique. And we combined both. And that is how the homographed wall bank was introduced in this country. Now again, we are the only people who have got a xenographed wall bank in the country. Why can't the other people do it?
Yes, I never understood that. Because if you could think it in that time, since then no one actually...
Yeah, there is no need of any, permission that this and that. In Hyderabad, you are in Hyderabad.
Yes.
There is a slaughter company known as Alansons. Al-Kabir and Alanson, they slaughter 500 buffaloes every day. What is happening with all these jugular veins? Exactly. You are paying 22.5 lakhs for TAVI. Now we are, we are manufacturing TAVI. We are waiting for phase 3. Now, what was the most important and difficult problem for TAVI? TAVI, you need memory metal, that is nitinol. You know who makes nitinol? Let me ask any of the cardiac surgeons or even the cardiologists who talk about TAVI. Do they know where nitinol is made? In India, there is only one place. That is HAL. Not HAL, National Aeronautic Limited.
Yes.
They are the only people who have got permission to make nitinol. And they have made nitinol, the stent for us. You know how much does it cost? 12,500 rupees. Where is your 12,500 rupees and 22.5 lakhs? Okay, if it is this Merrill, that is also, 12.5 lakhs. So nobody wants to do these things. Of course, there are a lot of, regulatory body permissions. That will come only if we all join together. I myself, as a stupid fellow, cannot fight against this. For that, if there is a group of surgeons or institutions which are prepared to do this 22.5 lakhs or 15.5 lakhs or my wall by the Chinese and all, we don't have to pay. We can make it for 2.5 lakhs.
Right.
Yes.
Yes, sir.
And nobody thinks. Everybody says, I have done TAVI. Any fool can do it. Even we did TAVI even in Parimala, in a village.
Yes.
So there is nothing much, so sometimes I see this cardiac surgeons 1, cardiac surgeon 2, the WhatsApp. We have done TAVI, we have done that, we have done this. What is there? There is nothing big about it. You do something good for the country rather than, go on replicating, I'll come to that.
Yes, sir. Sir, can I, yes, sir, please show it.
We have the largest private GMP lab with Form 29 certification. We also have other labs, such as the Tissue Engineering Lab, Nanotechnology Lab, and the Stem Cell Lab, with hands-on training facilities for students.
I'm glad Dr. Soma is there.
Yes, I wanted to bring in Soma and Satya Prasad. He just now.
You should ask her all these questions.
Yes.
Stem cell
Soma.
Yeah, good evening.
Dr. Radhakrishnan, Dr. Soma is one of the very oldest associate cardiac surgeons, one of the very oldest from with Dr. K.M.C. sir. So, Dr. Soma, can you recollect some of your very early days before we come to these innovations? Because there are some important, interesting anecdotes we have come across in those early 90s.
We have not spoken, only we spoke about the clinical side. A private hospital I joined in 1986, 26th of June. And he started on 6th of June. So I saw a private hospital just budding up. We had a PA course conducted. First PA course conducted, organized PA course. Dr. Radhakrishnan was the person who did the curriculum, we all sat. Then we had all these diploma courses in cardiology, cardiac surgery, in pediatric cardiac surgery, adult cardiac surgery, pediatric cardiology, adult cardiology, a private hospital having this academic section, and every Saturday having our academic session. Those days we used to be horrified really to attend that, but it had really helped us to excel, be up to date in our subject, progressive. And first thing, anything comes first, will be implemented in the institute. So that is extraordinary. As a private hospital, it is very, very extraordinary. One more thing I've always found, that if something has been thought yesterday, thinking that we should do it, it not should do it, it has to be done that day itself. That was the speed we had to follow. When sometimes it had been very difficult to keep pace with chief. And taking decision on the table, I haven't seen anybody doing that. In critical, complex cases, immediate decision on the table. It's something, and not only that, he has got plenty of friends all over the world. Anything happens in the ICU, call this person who can really help. So call, talk, implement. These are the things we have started, we have faced in early part of our journey in 1986. And I think at least 50% surgeons who are really doing very well in India and abroad have been trained in this Madras Medical Mission and Frontier Lifeline. International students came for training.
I think
Everybody knows.
I think if I know correctly, present President or Secretary of European, sir, if you remember, the Czechoslovakian surgeon, who
Yeah,
is,
his name is Ivan.
Yeah.
I show his photograph. He is
Yeah.
the president of the Artificial Heart Program for Europe. He was with us.
for training. Yes, I remember.
And another thing is very extraordinary for our institution was on a Sunday, you never expect any hospital having 7 cardiac surgeons around. What a transplant heart is coming. So since morning till night, we will be waiting. Not only surgeons, anesthetists, cardiologists, everybody will be around on a Sunday. Most of the time, the heart transplant will be done on Sundays. I mean, it is really tremendous. I never had seen any private institution and any doctors association working there are conglomerated on a Sunday like this.
Before I
So this
go
is
into
the
the
teamwork.
Radhakrishna, before I go into certain other little deviation from clinical, would you like to come in as a senior surgical gastroenterologist or invite someone? Sir is not about,
No, I'll be
cardiac
glad, Biswarup, because all his associates are reminiscent about their days. You should give them a chance. Dr. Satyaprasad and Dr. Ravi Shankar, they need to talk, and we want
Please.
to see what attracted
I can't see them.
to him, and what is that they learned from him, and what are the special things we are interested in knowing. We want the reminiscence for the, and also Priya Menon is on the.
Yes, Priya is,
well.
that is a
So we would
surprise
like
for
all of
sir.
them to speak about Professor Cherian, and then we'll come in.
So,
Dr. Satyaprasad.
Hello?
Yeah.
Yeah, I'm audible?
yes.
Yeah. Sir, good evening, sir. KMC, sir. Yeah. What else I can talk about you, sir?
No, not about me. This is about subject. You talk about
subject. You are the subject. You are the subject. Say, Swarup.
Yes.
Yeah, it's a great opportunity, Swarup. But I don't know. I'm not visible in the TV, but I will just talk. I'm not interested. Okay.
We can see you, sir.
Vishwar, see, this is 35 years over since I completed. And still I am learning. And still my heart is with KMC only. Okay. And he's the one person who gave confidence to everybody. It is not the degrees or the 2 letters matters. It is the dedication and the confidence which he puts into everybody. And once I joined him, I even stopped reading the books, because here I have a dictionary and an atlas of cardiac surgery. And I never used to see at him. I used to just learn everything from his 2 hands, which is moving. I'm not exaggerating. It is true. I learned only from the hands of Dr.K.M.Cherian, which was on the heart. So I always say, or even I have to tell, KMC is the secret of my success. And with his blessings, I completed 4 more institutes. And the secret is I'm going back to him. And sir, we started with a single theater and 4-bedded ICU. Morning 6 o'clock we used to start, and minimum 4 cases we used to do, elective cases. And in between an emergency comes, yes, we used to start. And literally he used to be with us. So there is no question of, we are running away. He is the standing example for all our success. I still thank him for all the help he has given me, and whatever I have done, the first TMR or first transplantation, with all his help and associated with him. And he used to push me into academics. My head was not useful for academics. I wanted only surgery and the numbers to increase. So I was useful to him in that way. At the same time, wherever I went, I just increased my numbers. And everybody knows. And once I was talking with Mata Amritanandamayi that I came from Dr.Cherian, you know what she told? He is God. Avan Ishwarananu. She told in Malayalam. Because he did lot of surgeries for Gujarat. So a lot of people in Gujarat used to tell that they got operated with Dr.Cherian. And she told me that he is a God. And that is enough for me. That is a stamp. Wherever I went, behind me, that stamp, Dr.Cherian is there. Thank you, sir.
Dr. Ravi Shankar?
Dr. Prasad. Yes, Swarup.
Yes, sir.
Is there anything more?
Yes.
Biswarup, before proceed further, I just want to know your interaction and your days with Dr.K.M.Cherian. I knew that he's one of the strictest of the whole lot, and he used to be very, very tough with you all.
The problem is what I used to think of him, my juniors think of me now. Even today I heard that. And I suddenly remembered while driving back to home, I was thinking at that time, I also used to think of MMM and the discipline and the hard work in this way. I mean, for me, it was, I was a Bengali who migrated to Chennai, who had studied in Mumbai. And entering MMM, it was like in Sanskrit, we use a word Pithasthan. That is the ultimate place for cardiac surgery and cardiac sciences. And I was the first student to enter PDCC, cardiac anesthesia and critical care. My late teacher, Dr. R.K. Kalyan Singh, is no more. So Professor Dr. Cherian and Dr. R.K. Kalyan Singh, and I was the first student. And I think Shiva that day reminded me that I was the first PDCC. Now, that apart, as I told you in the beginning, I deviated from cardiac anesthesia. I have become a liver transplant anesthetist. I have gone into liver, pancreas, various other transplants. But the thing is, the basic traits and qualities which I imbibed at that time, that getting up at 5, come what may, getting up at 5. At 6:30, sir will have incision. By 7:15, first patient will be on bypass. We practically lived in the hospital, but we always smiled and laughed because it was a great learning, and somehow tiredness never crept in. That has been definitely a good experience there. And a lot of things I do today, even clinically, took birth at that time from scientific point of view. Could you hear me?
Dr. Suresh Rao wants to say something?
Yes, Suresh.
Hello, sir. Good evening.
Yeah, good evening, Suresh.
So I've been very, very interestingly listening to all the presentations and all the comments which many have made. And I think Satya Prasad, Soma, myself, we're all together. And one thing which I wish to say is, I mean, it was the most, I would say, I consider myself blessed for having got an opportunity to work with Dr. Cherian. In fact, when I finished after my MCH and I was wanting to come back to Mumbai, someone told me that your training is incomplete if you don't pass through Dr. Cherian.
Yes.
So that's how, and to my good fortune, he came out of Railway Hospital to start Madras Medical Mission. And that's how I got my opportunity to work with him. And the time I've spent with him, I'll carry throughout my life. And not a single day, even now, we don't mention him in some way or the other, in some talk of the other, in the ICU or in the theater, or in our dealings with our juniors, seniors. So he'll always be remembered with us. But if you want me as a surgeon, I think I've learned all the skills from him. He's a brilliant technician, technical skills. And like what Soma said, what really made us good surgeons was the ability to decide and move forward on the table. And for a cardiac surgeon, what I really learned from is how to manage the heart lung machine to your advantage, which very, very few people really know. And as an individual, oh my God, I mean, he's a person who is always willing to change, accept new ideas, never get bogged down by the same traditional ideas. And if you dream of something, work towards it and realize it. And these are some of the things which the work ethic has really rubbed onto us and made us what we are today. And last thing is, I think he showed it to us that being in private doesn't make you less academic. I mean, I think we are much more academic than even the academic institutions, the way we have forged ahead. So these are some of the few thoughts which I would like to share with you as when I've been working with Dr. Cherian.
Can I call in Ms. Priya Menon? And I
Yeah,
just
are you
want.
there?
Is she there?
Hi. Am I
Yeah.
audible?
Yeah, this is your book, madam. Wonderfully written book. So we would like to know from you about Dr. Cherian's personal traits as a non-doctor, because you've interacted with him for over a period of 2 years. We just are very keen to listen to what is so special about him.
Okay. Now the thing is, it's a little difficult to separate Cherian the person from Cherian the doctor, but I'll try. So, because medicine is such an integral part of his life and personality. But I work for the Times of India, and I was asked to do this book in 2012. And because we have all heard about his medical feats, I was very eager to do it. And in the first few meetings that we had, let me tell you that it was a little difficult because it was in the hospital, and I think it's very important for a biographer to make that connect with the you need to break the ice with the person before you can go ahead. So I don't think like initially in the first few sessions that was happening, because he was very eager to talk, but there'd be a lot of disturbance and stuff. But I think the first time that I saw him in action, and I really felt very enthused about writing the book, is when I arrived. I was just going to go there, and he called up to say that there is going to be a heart transplant that day. And that day I saw him literally in action, not in the theater, but I saw him, out there, very, swinging into action, getting things ready. And I think that's where the kind of connect happened and where I got really interested in the book. But going ahead, his medical feats, all of you know about, and achievements. But I think he came across, first of all, as a very good student, because I began telling him that if we have to really talk, we need to be prepared, because I had limited time, he had limited time. So, and after a point, we began meeting away from the hospital. So I told him, like, for example, if today we are going to talk about your childhood, or today we are going to talk, 1 week from now, we are going to talk about the time you spent in college or school, he would come completely prepared with, like a really good student, having done all his homework and, getting all his facts there on his fingertips. So that was really nice. The second thing, I feel that, he was very honest, because in the beginning itself, I told him, I don't want to do a hagiography. And he also felt the same. So whether it is his, personal weaknesses or, what he felt were failures in his career, he was very open about it. He was very, and, later on we could take a call as to, how much we included. But I think he was very frank and forthcoming about his life, about his career, what he felt were the ups and downs. He spoke about his so-called failings with as much honesty as his achievements. So that was like really, really nice. It was very interesting. And I think that was very integral, because, not everybody would read a biography unless it showed the man as well as the doctor, the surgeon. So,
See, has he influenced your life in any way? Your work ethics, has he had any permanent impact on you?
Yeah, in some ways, I think, you influence each other kind of thing. So, I mean, work ethics, I'm also very committed to my profession piece also. So I think it went along well that way. But yeah, his sincerity to his work, where, you know, work comes first before everything else. That was really like impressive. The fact that, you know, no matter what time of day or this thing, the way he set apart time and prioritized his work, his commitment, that was like really good.
So if we can go back to Professor K.M.Cherian, I'm interested in knowing who all influenced him as a doctor. But first of all, I would know about his stay in KMC and who really sort of inspired him, because he's a person who thinks differently from all others, and that's been his trait all through his life. Sir?
Yeah.
In the KMC, who inspired you specifically and in what way?
So in fact, you know, I mean, working with Dr. Ullal was, I think, one of the most memorable period for me, because doing a closed mitral valvotomy or PDA or coarctation, something, you know, he used to encourage me. And I used to tell him my ideas. Even I can tell you, you know, I mean, I always think, you know, what I can do little different from others. That is the way I always used to think. So that is why even when I went to Australia and all the other places, when I used the needle holder, they all used to say, "What's the problem with you? Can't you do it the other way?" I said, "I can do it, but you can't do the way I am doing it." So that used to be my answer. So I had my own way of doing things in everything. So that is one. So I think probably Dr. Ullal is the one who influenced me. And when I went to US, it was Dr. Kirklin, because when I left, he asked me, "What did you learn? Did you learn anything?" Because, you know, compared to many other people, I was the only one who was given opportunity to operate, because I had my, apart from ECFMG, I had my license for practicing in Alabama. You know, if you pass in one state, you will get at least 5 states. So I had the license. So nothing prevented me from I mean, prevented them from giving me opportunity. So when Dr. Kirklin asked me, "What did you learn?" I said, "Sir, I learned only one thing. That is, I used to get into problems. Always I will come out, but it will be with difficulty. After coming here, I have learned one thing: how not to get into problem." So he said, "That's exactly the thing I expected from him." So he was one who influenced my life as far as the academic activities. 6 o'clock we have to be in the hospital, and 5 o'clock I used to go for my, I mean, running around the block. And Saturday afternoon only we will be able to go for little rest. So, you know, I mean, the time which I spent with him, once it so happened that that was a Thanksgiving day. So he asked me, "What are you doing for Thanksgiving Day?" I said, "There is nothing much. And everybody enjoys. I will also go to a pub and drink." He said, "No, you should come home. Jim is coming, and Patty is coming." Jim is Jim Kirklin. He was doing his general surgery residency in Boston. So I went for dinner to Kirklin's house, and I got drunk, and I was about to go back to my apartment. Then he said, "No, you can't go. You should not go. You won't be able to drive properly, because it's about 10-15 miles." And he said, "Come, we will sit and talk." And we went to his cellar. Sitting there, again I had few drinks, mixing up all these drinks, I slept off. So he arranged a place for me to sleep in his cellar. And I don't know when I got up. I got up, I think, probably 6 or 7:30, and I straight went to my apartment. The next day morning, it is a custom which I also do here. 6 o'clock, everybody rings up and says that what happened to the patient in the ICU, which I have been following from that time onwards. Even today, I follow it. And 6 o'clock, the call came, and I asked who is speaking. Then the other side, they said it is John. So I asked which John. So he said John Kirklin. So I said, I'm sorry, sir. He said, okay, it's okay. I called you mainly to say that you should contribute to 2 chapters in a book which I am writing with Sir Brian. So that is how I got into this academics. But even though I, cursed, why all these things. But today I know I had the opportunity to contribute in that book, which no other Asian had the opportunity. So in the sense I am saying is that, as I said in the beginning, this is your fate. You have to do it. I believe in it. And other people have not been able to get it. So I'm very special in that. There is nothing. It is a God-given opportunity. I caught it. I worked for it. Worked very hard for it. Risked a lot of things. And I'm happy that, whether nobody will come and ask me what is my bank balance. That is very important. Nobody will ask what was, how was your house, big house, small house, bank balance, what car, nothing. I have driven all the cars. I had a Ford Mustang Sports when I was hardly 26. So I have seen everything. I had the opportunity. I think probably I have done the best as far as the opportunities which have been given to me. Except that I am again saying, as youngsters, please don't get into problems like what I had. That is, you should take advice of others. But if you go and say that you want to start a stem cell bank and you want to start a, tissue engineered wall bank or these things, you need people. That is where, I was saying, I had colleagues like the Soma. She has been the backbone of tissue engineered wall. Now, if you are, we are doing we are true for animal experience as far as dairy is concerned. Even the Sputnik heart, that that weighs almost 200 grams. Now we want to reduce it. So I had a talk with Bhaskar Bhatt, who is the chairman of Titan. And there is a fellow there, Dr. Devagaon or something. Anyway, he is the head of miniaturization. Titan has made one of the watches, the thinnest watch in the world, that is known as, what is the name of that? The thinnest watch. Anyway, so he said, yeah.
It's edge, sir.
Edge, that's right. Edge. So he said we can make it 150 grams. So if we make that 150 grams, your all these, what the Heartmate 1 and 2 and that is and all will go. But this has to be understood by our people. Our Department of Science and Technology or DBT, that lady is a plant biology. How do you expect her to know about it? So the regulatory bodies and all these things are not very cooperative and will never be helpful. That one has to know. It is good to have the fire in your belly, agree. But the fire should not digest.
Babu Daniel, you want to comment? Babu Daniel is raised hand for a while now.
Who?
Babu Daniel.
Yeah.
Okay, Ilango, you have any questions?
Sir, yeah, a couple of things. I'm a transplant surgeon. Noticed one of from the video which you showed regarding the CABG in 1979 that you're palming the riders. Did you start using it at that point of time, or was it the maneuver for doing holding the instrument at that point itself? I saw you holding the instrument with the palm of your hand rather
Yes.
than.
That is what I was saying. I started that technique. I have taught a lot of people. All the people who work with me, they all learned it. Now nobody puts a thumb through that,
Yeah.
What is called, the needle holder. But, it becomes easy. It becomes quick. You don't have to remove your thumb. It is open. This is known as open palm technique. The same way, many people just go on throwing 7, 6, 8 knots. It doesn't mean anything. You have to put only 4 knots. 1, then a slip knot, then take the hand and 1 more knot. You will never go away. So there are small things like this. It makes things easy. People will, you don't have to be a pastor, but if you do these things, what is important is when I did the arterial switch first, he did not have glue, and I have never used glue in my life.
Dr. Hitesh Jagdish. What's the comment? Yeah, Hitesh.
Sir.
Yeah.
Sir, actually, I am a final year resident in Calicut Medical College, sir. I have got a very wild dream of becoming a cardiac surgeon. I doesn't have any plan B. So, but whenever I ask people, people will tell nowadays the trend is decreasing. Most of the seats are getting emptied. But even then, I doesn't feel like leaving it. What is the opinion of it, sir? Am I in the right path?
Now, it all depends on you. Now, you ask any surgeon today, young surgeons, can they do anything more than an off-pump bypass or a mitral valve replacement? Can you do a mitral valve repair? How many people can? How many people can do an open mitral valve? Forget about Ross procedure, forget about homography. Have you ever, will you ever take any opportunity? Last year, there were 17,000 motor vehicle accident death in the state of Tamil Nadu alone. How many homographs have been destroyed, thrown away? Now, see, when you talk about this homograph business, the Ross procedure, and the last time I think our meeting, I just presented what I gave in Atlanta Ross Summit, where Ross was there, Yakub was there, Carlos Duran was there, the few people who were doing Ross. All the others were not doing Ross. Why? It's no point in saying that one valve operation has been made into 2 valves. I have got, that time I presented 160 cases of Ross. The youngest Ross in the world has been done by us, which was seen by Don Ross. That was a 3-month-old kid, whom I reoperated after 7 years, and I replaced the aortic valve. Pulmonary valve was okay. So, you have to take the risk. Now, I'll tell you one thing. Please make note of this. When I have been doing it for the first time in the country, people said, you are taking risk. But they don't realize the fact that it is not me who is taking the risk. The patient and the patient's relatives. The patient knows I am doing it for the first time, but he has no other go. So somebody should be there to belt the cat. So when you know that you are doing it for the first time, your patient also knows that you are doing it for the first time. Who is taking risk? I think patient and patient relatives are the ones who take more risk than you. That night you may not sleep. The next day anyway you will sleep.
Madam Jayanti, you want to come in?
Very innovative talk, very inspiring, very nice. I was working with Professor Solomon Victor at Vijaya Health Center on Budd-Chiari syndrome. So lots to learn from you, sir.
Who is this?
I am gastroenterologist, Dr. Jayanti.
Perfusionist.
You know, I thought it was Prasad, what is that girl's name who was working with Solomon Victor?
Hey, who is that anesthetist?
No. Naik.
Yeah,
Naik. After that, she worked with us for a year before she went back to Bangalore.
Very inspiring talk, sir. Even at this age, we feel enthralled by your talk, sir.
You think I am that old?
Sir, I said I am old. I said I am old, sir, not you, sir. I said I am growing old. I said as I'm growing old.
I thought even at this age you are talking. Okay.
Thank you very much, sir. Thank you.
So, Dr. TRG, sir, your comments?
Sir, I am Dr. Gopalan, sir. I am a general surgeon. I attended your program in the Madras Medical Mission in your auditorium, where you had a convention of honoring the heart transplant patients. And I had come there and attended that function. And I remember it very, very well, sir. The talk was excellent. I just wanted to ask you one question, sir. Having seen the growth of cardiac surgery from the very roots and how you trained up and brought up several cardiac surgeons entire over the country and Tamil Nadu, I am wanting to know what are you thinking about the latest advances in cardiac surgery as far as the non-interventional cardiac work going on and as well as the minimally invasive cardiac surgeries. What are your thoughts about it, sir?
Now, see, this is a fight between the cardiologists and the surgeons. Right?
Industry driven.
The cardiologists, they will say that you will not have a cut in everything we can do through your femoral artery or vein or whatever it is. Then the surgeons want to compete with them. They know that a cut has to be made. So instead of a classical sternotomy, it comes a mini sternotomy. What mini sternotomy? It is only the skin incision is short, but you are cutting the sternum. Now, goes for the thoracotomy. None of these people know that we used to do all the mitral valve, KSTs, tricuspid, valve repair, everything through the right thoracotomy. Because it was very difficult for me to standardize, getting people to do cannulation through a small right thoracotomy, so it was standardized. Now, then the robot came. Now, this is all trying to compete with the cardiologist to say that we can also do it and our incision is also small. So this is question of ego problem. What is important is this: if a patient needs 4 grafts, he needs 4 grafts. If he needs endarterectomy, he needs endarterectomy. You can't do those things through a small incision. I don't believe we have got surgeons who can do that, any surgeon. So, I mean, this is all trying to hoodwink the patients. If somebody asks me if I need a bypass surgery, I'll say do a classical coronary artery bypass. Now you have got stents. And there again, it is different. Now, stem cells. So many things are being. Why? What prevents you from doing stem cells? You have got academic institutions, you have got All India Institute, you have got Bombay, you have got Chitradurga, you have got that, all those. What is preventing them?
Exactly.
It means only one thing. They are not prepared to take the risk. There is a Rajiv Gandhi Research Center in Trivandrum. Why can't they make use of it? It's very easy to talk.
Radha?
Thank you, sir. Thank you very much.
Dr. Krishna Manohar, you want to say something?
Who?
Krishna Manohar.
Yeah,
Yes.
can I talk?
Yes, yes.
So it has been, I worked with him. I was 1 year junior to
Can you
Suresh
put your
Ram.
camera on, please? Yes.
Okay. Can you see me?
Yeah, we can see you.
Yeah. Sorry. I work in Satyasai institutions. Satyasai, as you know, is totally free of cost. So the Satyasai Paediatric Hospital in Raipur, we started, and we were all sent by K.M.Cherian sir. I was working with him for anesthetist, pediatric cardiologist. We all came.
Krishna Manohar.
Yes, sir.
Oh, okay, okay.
We all came and started in 2014 with his blessings, and he has been our patron and advisor and big supporter. So we started in Raipur, and then we started a second institution in Delhi. I am working in Delhi now. Third one we started in Mumbai. So together we are doing almost to 300 pediatric cardiac surgeries totally free of cost every month. We have crossed 12,000 total number. So just to tell you, we are all happy, and every day we do. Today also we did 4 cases here in Palwell. Every case belongs to KMC sir also. He's in counting. Just want to say hello to him, and then our best wishes. And what we are doing every day, it is his blessings, and the number belongs to him also. Thank you, sir. Thank you very much.
Thank you.
Sir, KMC sir, before I hand over to Biswarup, I have one question, one delicate question. You've been a great innovator, an adventurer, and you're also fond of good life, good food, good cigarettes, good fenny. And, you know, pretty woman, what I see from the book. And again, what keeps you fit and going, and what makes you happy? What are the things that make you happy every single day?
Rather, I will interject. Sir is very good in painting and drawing. I don't know if he's sir.
That part I didn't come across in the book actually, but
but I remember sir used to be very fond of his own his painting and drawing.
Okay, let him answer my question. What makes him fit? What is his schedule, and what makes him happy?
Well, I have been doing, I mean, even from my younger days, I was a tennis player in the school. And in fact, 3 years consecutively, third, fourth, and fifth, fourth, fifth, and sixth, that is SSX. I used to get the single and the doubles tennis. So that is one. Second thing is I used to play little football, no hockey. That I used to play even in KMC. Because I live, my house is just next to the river. So I go for swimming. I enjoy swimming. I enjoy fishing. And because I was in the forest, estate, I love hunting. You may not believe that I hold 7 weapons, including 308, with the telescopic lens. So I have enjoyed life in the sense, Now I have got a sports car which is 1937, Sunbeam Talbot. So these are all my interests. One. Now, I have no problem in saying whatever I have done. I mean, if I can talk to somebody like Priya, a young lady, my affair, etc. I have no problem. If you're a human being, you will have all these. I'm not saying that I'm a saint.
Most candid conversation.
What keeps you fit, sir, now? And
I told you.
What makes your brain active all the time?
That is when you think. If you go on thinking, your brain will be active. I do 45 minutes treadmill even today, 6 days a week, and I don't eat much, and I don't drink. I don't observe. Maybe one drink once in a month or once. There were days I used to drink almost every day. When I was in St. Vincent's, just opposite to that, there was a pub known as Paddington Green. If I tell you, I had a good girlfriend there, that was Olivia Newton-John. You may not know.
Back to you, Biswarup.
Sir, I think we can just go on and on, but from your extremely
We have
busy
5
schedule,
more minutes. Yeah.
yes, before I wind up, sir, you said 8th March, your last birthday, you called it a day or pulled curtain on your surgical activity.
Yeah.
For me to imagine KMC not operating, and not coming to hospital is not possible. I'm sure you'll be active.
No, I come to hospital at 8 o'clock, I take rounds, and I got a lot of, because I am more interested in research.
Yes.
I got a lot of research work going on, which not many people do it, and they never imagine doing it.
Yes.
Whether it is zebrafish. Now tell me which cardiac surgeon is working on zebrafish. Okay. And we are working on, growing our own large organs, kidney, liver, heart, using a scaffold.
Can you hear me anymore, sir?
Yeah,
Sir, can you hear me?
Yes.
Sir, then on
shark fin scaffold we are using for growing large organs like heart, etc., so that you don't have to wait for any donor organs.
Yes. Sir,
now, which private hospital will do it? If you do it, you will go bankrupt.
Exactly.
I don't want another hospital to go bankrupt.
Exactly.
I have seen it this happen. With all my passion, with all my interest, passion, hard work, everything. Don't do that mistake. For God's sake, please don't do it. That young fellow who asked me that he wants to do cardiac surgery, please do cardiac surgery and keep on doing cardiac surgery. The problem is that everybody wants to see that as soon as you finish this thing, he wants a Benz or a BMW or something. That all doesn't come. It will come to you as long as you are sincere in your work. Most important thing people today doesn't understand is this. Patient should know that you are concerned about their health. Then there won't be any CPA and all, because you have done your best. No consumer protection case will be against you. They know that. I mean, we can't save everybody. We are not God.
So with those invaluable advices at the end, on behalf of LGS and Dr. Radhakrishna, and all my colleagues who participated. And there is a WhatsApp group called KMC's Mavericks, and I'm very proud to be part of that. That word represents what KMC is all about. Sir, wish you a very long life, and I hope part 2 of your autobiography is coming, and we will come across again on the screen.
Okay, Biswarup, I understand sir's WhatsApp status is live life king size.
Yes.
I think is a standing example.
That also somebody has written. I don't know. I have nothing.
How can somebody write your WhatsApp status, sir?
I have nothing to do with it.
It's a privilege talking to you, sir, and it's an inspiration to a generation. Thank you so much for spending time with us, and we hope to come back to you some other time. Thank you so much. Thanks for the evening.
Have a very good night.
Lovely. Thanks,
Thank you very much,
bringing all together.
Thank you, and keep safe.
Oh,
Bye.
thank you.
Okay.
Roma,
Yeah,
Yes.
how is Madras is very hot, isn't it?
yeah.
Terribly hot.
Now
Good
there's
night.
depression in Bangopasagar, so there will be cool again.
Thank you once again. Thank you all.
Thank you,
sir.
sir.
Thank you so much.